Good morning. This is Carol Dixon, the Idaho Federation of Families, and welcome to our November Parent Webinar Series. We're excited to have Teresa Heald join us this morning. Teresa is a licensed clinical social worker, and she has a private practice, a Vibrant Life Counseling and Wellness, and she also works at Children's Therapy Place. A couple areas of specialty is with children's as a play therapist, and then she also works with children, teens, and adults. So we're excited to have her present this morning on a parent's crucial role in engaging in your children's mental health treatment. A couple housekeeping issues is one, we will be sending at the conclusion of the webinar an email that has a survey. Again, these are really quick, short surveys. We really appreciate your feedback on our webinar series and any ideas you have on future topics. Also, we have on the side, I believe there's a place where you can put in questions, and we will be keeping track of questions and providing those to Teresa at the end of the webinar. And then for next month, in December, we are looking forward to presenting our Youth Move group who are coming back to do a second topic on what they would like their parents to know in regards to supporting their mental health treatment. So with that, Teresa, thank you very much for joining us. We're looking forward to your topic, and I'll let you take it away.
Great. Thanks so much, Carol. I'm so glad to be here with you all today. Thanks for tuning in. I've got a lot of information to share with you, and so stick with us, and we're going to learn a lot today. So, slide, please. Today's agenda, we're going to be talking about several areas that are important in order to keep us on track. So the first thing we're going to talk about is briefly the prevalence of mental disorders among youth, the impact that the mental disorders of your children has on not only the child but also on you as a parent, the barriers to participating in your children's mental health treatment, how to overcome these barriers, which is amazing. There are ways to overcome them, and practical help for you as parents. So let's talk now about the prevalence of mental disorders in youth. In the United States, it's estimated anywhere between 13 and 20% of youth, that's children up to age 18, in the United States experience a mental disorder in any given year. That's up to 1 out of 5. That's a huge amount. Less than 20% of these children, out of that 1 in 5, only about 1 of them are actually receiving treatment. It's a huge problem in our country. Now let's turn to the impact on children of having a mental disorder. We're going to talk a little bit about the biology of mental illness. There have been discovered genetic glitches, that we're calling them, that increase the risk factor for children developing mental disorders. And the big 5 are ADHD, bipolar, major depression, schizophrenia, and autism. So you combine these genetic glitches with other genetic and or environmental factors, which results in the development of mental disorders. So it's not just the way they were parented. We're parents, we get blamed for it. And it's not just genetics. It's oftentimes a mixture of both. So what are some of those environmental factors? I'm not necessarily talking about the climate or, if you live in the mountains. That's not what I mean when I say environmental factors that impact the development of mental disorders. Things such as abuse or neglect, disrupted attachment. In the first 1,000 days of a child's life, that's the prime time for attachment to a figure, a mother figure, a father figure occurs, and it helps a child learn how to trust, learn cause and effect, and learn how to regulate their emotions. So if that attachment period is disrupted, that can also lead to the development of mental disorders. Nutrition and exposure to toxic substances such as pesticides, alcohol or drug abuse in a parent or close family member that's living with that child can cause or influence the expression or development of a mental disorder. Stress, that's a huge one. The child's experience of stress or stress within the family system can actually cause the development of mental disorder. Trauma or violence can also cause the development of mental disorder. And a new one that we may not be aware of that I want to discuss a bit today is bullying. When a child is bullied, whether by a sibling, a parent, neighbor kids, peers at school, that can also impact the development of a mental disorder. If a parent has an untreated mental health issue themselves, that can also influence the child's development of a mental disorder. Poor parenting skills can also impact the development of mental disorder, and parents are often blamed for children's behaviors and symptoms. I'm not trying to blame us today. I do need to acknowledge it, however, that if parenting skills are not up to what the child needs, that can impact or worsen symptoms of mental disorder. And finally, another environmental factor is poverty. Poverty itself puts kids and parents at great risks for negative outcomes, and some of those risks are depression, which is a mental disorder, child maltreatment, adolescent delinquency, teen pregnancy, dropping out of school, homicide, and suicide. These are serious impacts that poverty has on not only children, but parents. So how many kids live in poverty in the United States? About 22% of all children under 18 in the United States live in poverty. That's a huge number, and imagine the impact that that's having on children's mental health. So long term, what is the impact of mental disorders on children? Well, it increases their risk for suicide. They often have poor educational outcomes. And in adulthood, they have work-related impairments. Mental health has far-reaching consequences. Well, let's turn now to how mental disorders on children impact us, the parents of children with mental disorders. And you notice I said us. I am the proud parent of 3 now grown children, 2 of whom had severe and persistent mental disorders throughout adolescence, childhood, and now into adulthood. So I'm one of you, not only as a professional, but I'm here as a parent. The very first discussion of how parents may be impacting, how children may be impacting parents was in the 1920s by a psychoanalyst named Sandor Ferenczi. And he said that children or a child is not a unit separate from the family process, but that's integral to that process. So let me give you a brief overview on family systems theory. So families are interconnected and interdependent. Each person is part of that family system. You can't understand one person apart from understanding the whole family, and changing one part of that system, i.e., one person in that family system, impacts the other parts. I think we got that done in less than 60 seconds. Something about the family I'm going to call the family ego mass, and I will use this throughout the presentation, so just kind of keep that term in the back of your mind. What's important to understand about family systems is that it's cause and effect. Parents don't just impose their views and impose their lives on the child. The child is also impacting the parents. And as a parent of a child with mental disorders, you understand that your children impact you in very serious ways. Kids have effects on us as parents. The first professional discussion on this topic of the impact that children who have mental disorders actually have on parents, not just that they impact the family in general, but on the parents specifically, didn't occur until 1977 with a book called Child Effects on Adults by Bell and Harper. Up until that time, and still to this day, parents' behavior is often blamed as the sole cause for children's mental disorders or the children's negative behaviors, and we know that that's not always true. There are other environmental factors that influence children's development and behavior. As we saw, as I read that long list of things that impact children aside from parents. yet the public continues to see parents as the sole and prime influence on children. Well, there's other non-genetic influences on children that not necessarily impact mental disorders, but impact children in general. And I'll just list off a bunch of them, and I'm sure that you have more that you could add as well. Social media is the prime one. The larger culture, materialism, your children's social groups or peers, religious belief within the child, him or herself, within the family, and within the culture in which you live. The political climate, advertising, the neighbors or the neighborhood in which you're raising your child or children. The kinship system, that includes your children and their siblings. The school environment, that's a big impact. And your own child's health and your health. What we know about pain, if your child suffers chronic pain, is that pain can also impact depression. And it's a catch-22. Depression can cause somatic symptoms, and pain can cause depression. It can be an ugly, ugly system. I'd like to turn now to something called the parenting burden. That's the outward observable impact and emotional impact of caring for any child that has disabilities, specific today or mental disorders. When the severity of your child's symptoms increases, it also increases your parenting strain and perceived burden, including your own stress level. What we know about children with mental disorders is that children with externalizing disorders, those are things like bullying or violence or vandalism, the behaviors, the negative behaviors, and internalizing symptoms that occur at the same time, such things as worrying, somatic complaints like, I don't feel well, my stomach hurts, I can't go to school, unhealthy shyness or withdrawal. Those parents that have children with both the externalizing and internalizing symptoms report the highest level of stress and strain. So if you have a child or children with both of those types of symptoms, you're going to be experiencing the most stress of any of us parents. The perceived burden of parenting and your perception of that stress also predicts how often you will seek out mental health services for your child. You're likely to seek out mental health services, and your children are more likely to receive school services if you perceive that burden as being very heavy. And caregivers of all special needs children, not just children with mental disorders, but parents of children with special needs experience more stress, strain, and their own depressive symptoms than any other parents. Well, what might parents encounter? Here are some of the things that we encounter. Shame, guilt, helplessness, rationalization of the cause of our child's disorders. Well, it was those, immunizations I got. That's what brought on autism, and we've discovered that that's not always the case. Hopelessness, anger. That's very common for parents of children with mental disorders, is to feel anger, not necessarily at the child, but anger at the situation, anger at the system, anger at the pediatrician who can't help, anger at the med manager who, can't find the right mix of medications to stabilize your child, anger at the therapist, anger at the school counselor or the special ed teacher. Parents also can encounter self-blame. What have I done wrong to cause my child to have these behaviors or have these symptoms? What am I not doing right? Blaming someone else. It was her father's genetics that did this. Stigma is still huge in this culture. Even though we talk more about mental health in social media, there is still a stigma attached to having a child, or if you have your own mental disorder, to having a label of ADHD or depression or bipolar disorder or autism placed on you. There's still a stigma attached to it, and parents encounter the full brunt of that. Conflicting or condemning religious beliefs or superstitions. It's especially hurtful when family members will say things to you that suggest that somehow your child is not okay simply because the religious beliefs are not shared and the religious beliefs do not acknowledge the actual presence of mental disorders. Systemic obstacles such as time on waiting lists, maybe the community you live in doesn't have access to play therapists or med managers or the right treatment that your child needs. And finally, grief. As parents, we experience grief when we learn that our child has a major mental disorder. And there is almost no literature on our experiences of grief out there. It's very, very difficult to find. Our grief as parents is often not recognized or even validated. It's often misperceived as our own mental health issues when in fact it's grief. And professionals and other family members and friends who don't recognize our grief response, it actually can impair our own healthy expression of that grief, and it could worsen problems for not only us when people don't understand our lived experience, but it can also impact our children. Well, in one of the research papers I read, the parents of adult children with mental disorders suggested 2 ways to mitigate that grief response. And the first was for professionals to educate the parents on their child's mental disorders. I'm going to tell you a quick story here. One of my children has bipolar disorder. And when that diagnosis was first given to my child when they were in elementary school, it hit us both very hard. And when I asked the psychiatrist, I asked, well, what is bipolar disorder? He looked up at me and said, look it up. And that was the education I received from that professional. So one way that parents want to have our grief acknowledged is to be educate us. Professionals, please educate us on our child's mental disorders. And also, number 2, a suggestion for addressing our own grief that these parents suggested would be to involve us in sessions. And that is so important because I am also a professional and I treat children with mental disorders. It's important for me to recognize and other professionals to recognize the importance of involving parents in treatment. Another issue that parents may encounter is a traumatic response. And I just discovered this a few months ago when I was doing research for this. Parental trauma is unacknowledged and under-researched. And there are 3 times specifically when our trauma, as a result of having a child with a mental disorder, rears its ugly head. The first time is generally upon that initial diagnosis. And when I look back on my own parenting experience of children with mental disorders, this is what I recognized. That initial diagnosis was the hardest. It was traumatizing, and it caused me a great deal of grief. Think back to your own experience of hearing your child or children's diagnosis or diagnoses, and you may have had a traumatic response as well. Another instance when you may have a traumatic response is when you need to place your child in a hospital, either voluntarily or involuntarily. Maybe they're taken there in handcuffs. For homicidal ideations, threats, or attempts, these actually can cause you to develop PTSD. So please take care of your own mental health and acknowledge that you may have had a traumatic response as a result of your child's mental disorder. And finally, parents are often traumatized through the juvenile justice system. There is some very limited research on this. However, we know as parents, if you've had a child taken away in handcuffs, that you can actually be traumatized, because if your child doesn't show up for court, they could arrest you. Also, to see your own child in handcuffs in a courtroom is awful. It's a traumatic response. Your child's well-being and safety is compromised. And when they're in juvenile detention, you can't get them out. So why are we talking about the impact on parents? Why do we even need to acknowledge that our children's mental disorders have an impact on us? Because understanding our lived experiences is going to inform how we interact with mental health care professionals and other professionals for the care and services that our children need. And we want to be engaged in our children's treatment because, here's the important part, engaging in treatment is associated with better mental health outcomes for our kids. Your presence, your involvement in mental health treatment actually adds benefits to the child beyond the benefits and gains they can achieve if the child were in treatment without your involvement. This is huge. I hope you understand how important you are to your child, not only as a parent, but as an involved team player in their mental health treatment. So let's turn now to barriers to engagement, and also the importance of staying in treatment long enough for it to work and for it to make a difference. Less than 50% of all children whose parents have signed them up for therapy, CBRS services, or med management actually appear to that first visit. Less than 50%. And more than 2/3 who actually show up actually drop out within the first 7 sessions. Less than 10%, if you see on that pie chart, that small slice of pie, less than 10% of children with mental disorders actually remain in therapy at the 3-month mark. Well, as a therapist, I'm here to help you understand that that's not enough time for your child to make serious gains in the treatment of their mental disorders. It's just not. Kids don't go to treatment unless the parent insists that they go and make sure that they actually attend. You are the gatekeeper. You as the parent are the determining factor of whether or not your child actually receives the services necessary to help them succeed, to help overcome the negative aspects of their mental disorders. You are so important. Well, what are some barriers that we can address? Well, there's some pre-treatment barriers before you even make the call. Such things that we talked about before, the helplessness and stigma of having a child with a mental disorder. There's also parent factors to consider, such as maybe you're having marital problems and you just don't have the energy to find a therapist or find a med manager. So your child's treatment goes on the back burner, but while you are addressing your own issues. Perhaps you have some distrust in helping institutions. If any of you have ever had a CPS call made on you, you might distrust social workers. You might distrust revealing certain things to those individuals. There could be language or cultural barriers. You might have a lack of acceptance of your child's diagnosis. You might still be dealing with that denial piece of grief. You're not ready to let your child start treatment because you're still dealing with the fact of, oh my gosh, the pediatrician says that my child has ADHD. What does that even mean? You still might be dealing with that initial denial. There are also logistical barriers that you may encounter. They could be concrete, contextual, or agency obstacles. Concrete barriers could be such things as you just don't have sufficient time. You can't take time out of your busy work schedule to go pick up your child from school, take them to therapy once a week, drop them back off at school, and get back to work. That could be a logistical nightmare. You might not have adequate transportation to do those things, and you might not have childcare for your child's younger siblings. Could be contextual, such as community violence or the location of the child services. And it could be agency obstacles themselves, such things as time on waiting lists, the availability of a specific mental health professional that you've had recommended to you, or a specific intervention. Maybe the place you were referred to doesn't have a play therapist or someone well-skilled in theraplay or dyadic developmental therapy, which might be what was recommended for your child. And maybe the place doesn't even offer children's services at all. There could also be perceptual barriers. That's what you as a parent perceive as barriers. Such thing as you might not perceive your child needs treatment, even though the school system and their grandparents are saying something's wrong with little Johnny, he needs some help. You could even perceive that the barriers might not be so bad. Oh, he'll grow out of it. Maybe he won't. Maybe it truly is ADHD or a mood disorder. Your expectations for therapy could be a barrier. Maybe you expect that the therapist, within a 3-month period of time, can wave his or her magic wand and all of a sudden your child won't have encopresis and have nighttime accidents. That your child will overcome bipolar disorder, which in fact is a lifelong condition. Your beliefs about the therapeutic process. Maybe you believe that the therapist should be able to fix my child Well, no therapist can fix your child. Mental disorders can be addressed and treated, but some of them are lifelong and cannot be overcome, such as bipolar disorder or major depression. Still means that the child can have a great life, but they're going to need to be in treatment likely for the rest of their life if they have one of those major mental disorders. Another perceptual barrier could be the poor therapeutic relationship between you and the provider. And that relationship is so vital because that's where the child is going to be receiving treatment. And if you have a provider with a poor relationship to you, it is up to you as a parent to seek out a different provider so that you have a solid relationship with that provider, so that your child can have a solid relationship and therefore get better. We're talking about this therapeutic relationship because since 1993, it's been a reliable predictor of how the child can adhere to treatment and also the outcome of treatment. So if you don't get along with your child's provider, you've got to find one that you do get along on. Your child's well-being depends upon it. Let's turn to some predictors of treatment dropout. These are things that we know statistically that cause parents to pull their children out of therapy, out of services, out of med management. The focus of treatment. The professional's lack of empathy. That's a big one, that therapeutic relationship. Child's contact with deviant peers. If your child continues to be in contact with other kids with similar problems or that are just encouraging them maybe to steal or to skip school or to smoke weed, that's going to predict they're going to drop out of treatment because their peers are going to try to convince them not to show up or to make it so difficult for you as a parent that you don't want to take your child to treatment. Ethnic minority status can also predicts dropping out of treatment. Try to find someone who's culturally sensitive and appropriate for your child's needs. If you have adopted a child or if your child is a different ethnicity than their treatment provider, if the therapeutic relationship is intact, that's great. If it's not, seek to find an ethnically aware treatment provider for the benefit of your child. It can prevent treatment dropout. Externalizing disorder symptoms. Those are the things that we talked about earlier, like fighting, vandalism, bullying. Those are the externalizing behaviors, defiant behaviors. If you're from a low-income family, it can also impact your ability to even get to sessions at all. Having a younger mother, for some reason, was also indicated as a predictor of treatment dropout. Living in a single-parent household with no father also predicted treatment dropout, and that hits close to home because I was a single mom for 11 years of my children's life, but they were engaged in treatment. It was more difficult, though, than it would have been had we been a two-parent family. The parent having more psychiatric problems themselves, obviously, if you're symptomatic, if your depression is so heavy that you don't want to get out of bed, it's going to be difficult to get your child into the car and take them to treatment. So it's also important for you as a parent to treat your own mental disorders for not only your well-being, but your child's well-being as well. Poor parenting was also indicated as a treatment dropout predictor. And we have a 0 to 10 scale. It's coming up. I'll touch more about that later, so stay tuned. The family experiencing more treatment participation barriers in general, especially if you live in a rural area. There's a lot of treatment barriers that you encounter. Having more cancellations or no-shows. Well, yes, if you're canceling or no-showing, it's likely you're not engaged, and it's likely you will drop out. A lower perceived relevance of treatment. So if you don't think that treatment is relevant, it's unlikely you're going to be taking your child there every week if that's what was indicated. And the family experiencing more stressors in general is a big predictor of treatment dropout. Well, how do we overcome these treatment barriers? Well, there's lots of ways. Let's focus right now on 3 aspects of engaging in your children's mental health treatment. Those three aspects are our actions, our thoughts, and how we feel. Let's turn first to our actions, that first aspect of engagement. Actually participating in treatment. That means don't just drop your child off at the door and you go sit in the car on your smartphone. Actually go into the lobby, make eye contact with the treatment provider, and go back into session as appropriate especially if you have an issue or if the therapist or treatment provider requests that of you. Keeping appointments. It's important that you have some type of calendar system. These are practical tips. Some type of practical calendar system so that you can keep track of your child's appointments. You have a different hat that you've got to wear when you're a parent of a child with mental disorder. You become their chauffeur and their service coordinator. You need to arrange for transportation, whether through yourself or maybe if you have to work, maybe grandma can drop them off this week and maybe you can drop them off next week. Or if you have Medicaid transport, make sure that Medicaid transport shows up on time. Making sure you schedule time off work if you do work so that you can get your child to his or her appointments. And arranging other child care for your younger children so that the child with a mental disorder can be the focus of treatment and not you keeping your little 1-year-old from climbing the walls in the therapy room. It's important that you arrange for for child care for your younger children as well. Another action you can do is adhere to treatment recommendations. You are taking your child to professionals for input, for advice, for treatment. And if a professional recommends something, they're doing so because they're generally evidence-based, meaning there's evidence that this child can benefit from the treatments. So let's say that a treatment provider recommends psychotherapy or play therapy every week. It's important that you stick to those guidelines. Maybe the med manager says, I need to see little Susie every 3 weeks. It's important that you don't cancel and schedule it every 6 weeks and then call them frantically looking for a medication refill before that time. That's concrete action you as a parent can take to ensure the best mental health treatment for your child. And you also want to stick with recommendations long enough to see them work. For example, maybe your child's school counselor recommends that you do chore cards. You have chore cards for your child. Instead of grounding them for 3 days, they have the option to come out and do a few chores so that their grounding can go away. If you only implement that for 2 days, that's not long enough to determine whether or not that intervention is going to be successful. Stick with it long enough to see if it does work with you and your child. And also seek out all resources that you can. If you're living below or at the poverty line, seek out all resources you can as a family to bump up your available resources and your financial strength, as we know that poverty has such a huge impact on the expression of mental disorders in not only your child but you as well. We want you to be healthy and happy and engaged as a parent, and having a decent income and your resources and all your needs met can help do that. So you can oftentimes ask your child's therapist, a school counselor, or if you're lucky enough to have a school social worker at your child's school. Those are resources that can point you in the direction to help you overcome the negative impact that poverty might be having on your family. Another aspect of engaging in our children's treatment is our thoughts. Do we think that treatment is believable? Do you believe that sand tray therapy is going to help? Do you believe that talk therapy is going to help your teenager? Do you believe that psychotropic medications are going to help your child with bipolar disorder? Are treatments convincing? And are they logical? Does it make sense for your child to take this medicine 3 times a day to you? So it's very important that you understand your own thought process as your child's treatment is evolving, is being presented to you. And the third aspect of engaging in our child's treatment is how you or how we as parents feel. Our emotional involvement in sessions is so important. That's why I encouraged you, not just with your actions of actually showing up with your child, but actually being engaged in the session, sharing back and forth, sharing the actual day-to-day happenings that goes on in your child's life or how you're feeling about your child's treatment, sharing it with the provider so they and you can get on the same page. Having a positive attitude towards treatment instead of, oh gosh, we got to get you to therapy. It's 2:00. Saying, all right, time for therapy. It's going to be a good day. Having that positive attitude. Oh, you always have fun when you go see your therapist. It's almost time. We got to get in the car. That's going to help your child look at therapy with a positive a positive attitude. Look at going to their med manager with a positive attitude. Look at getting to see their CBR service worker with a positive attitude. Remember, you as a parent have so much impact and so much influence on your child. And finally, your trust in the therapist or the mental health provider is so important. If you don't trust that provider, you need to either work on your own issues or find another treatment provider. You have to be able to trust the treatment provider to be with your child so that you feel comfortable and stay engaged in your child's treatment. Remember that engagement is an ongoing process. It doesn't happen just at first. It happens throughout your child's course of treatment, whether it's med management, CBRS, respite care, therapy. It doesn't matter. Your engagement is ongoing. When you have a child with a diagnosable mental disorder, especially if it's one of the big five that we talked about earlier, treatment is likely going to be needed throughout the child's entire lifespan, which means you as a parent are going to be engaged at least until the child is old enough to take over some of these roles themselves. At different times and at different levels, your child will need your involvement. Perhaps 1 year they'll need lots of treatment, and as symptoms and distressing behaviors might come under control over the course of treatment, they may need less and less as time goes on. Let me give you an example. Perhaps you have a 10-year-old right now who needs a lot of treatment, weekly therapy, monthly med checks, CBRS. In 2 years, maybe you will need only therapy every other week and maybe only a med check once every 3 months. Your involvement will change based on your child's needs, but what they need constantly through the time of their childhood is your involvement. Well, we actually need a framework of sorts to understand our role in mental health treatment and in your child's recovery, and we actually have a framework. So in any given course of treatment, there are 6 components, and I've listed them here for you. They're on your screen. The evaluation phase, that's where you're getting an assessment for services and how the provider can help. Then there's the beginning phase. Sometimes I call it the honeymoon phase. There's the middle phase where most of that heavy work occurs. There's a pre-termination phase when signs and symptoms are becoming less and less. And there's a termination phase where you actually say goodbye to the provider. And then there's a post-termination phase. Let's touch base on all of these so you understand what I mean by phases of treatment. So the evaluation phase is the time when you join with the mental health professional. That means you welcome that person onto the child's team. They now become a team player in your child's mental health treatment. You have your child's well-being in common. That's the joining part. During the evaluation phase, you are always and will be equal, but it's important that you recognize this. The treatment provider isn't up here and you're the lowly parent down here. You are at equal level with the treatment provider. You both have the child's well-being in common, and you as a parent are the consumer. So what you say is vitally important because you have the power to fire that treatment provider. You do. Own your power and recognize that if you don't like this treatment provider or something feels a little off, seek out another one. You're equals, not like this. You are absolute equals with that treatment provider. At the evaluation phase, the treatment provider is likely to provide you with a treatment plan or treatment recommendations. You have the role to either accept those treatment recommendations, help modify them, or reject them outright. You also want to weigh the benefits and risks of following a particular treatment plan at that time. For example, let's talk about medication management. Let's say you take your child to a nurse practitioner who specializes in the treatment of children with mental disorders. And after that initial evaluation, the nurse practitioner recommends stimulant medication and some type of sleep medication to help with weight and things such as that. You can accept the benefits that they'll sleep better, and with the stimulant medication that they'll be able to concentrate and sit still in school so that they're more able to succeed and not get in trouble and not cause trouble with their peers. Or you can reject it based on the risks. Oh, the stimulants can also cause slow weight gain or weight loss. Stimulants can also have other negative side effects, such as the jitters or difficulty concentrating. And you can weigh that and either accept what the med manager recommends or voice your concerns, like I just did. Say, I've heard that, Ritalin or Adderall can actually cause children to lose weight. How do you feel about that? And actually have a dialogue with the treatment provider. Or you can reject it outright and say, there's no way I'm putting my child on those medications. But still, the control is in your hands. You still have that role. Now, there are risks to denying a child medication that's clinically indicated. Number one, your child could have worse behaviors at home or at school, and they could wind up eventually in the juvenile justice system or expelled from school if they don't have an IEP. Those are some risks that could happen. Also, during the evaluation phase, as parents, it's important that we balance humility with the reality of our children's mental disorder, and also with our own confidence as being the parent. And what do I mean by balancing humility? I'm going to give you a personal example. I went into my children's mental health treatment with a little bit of an attitude. I had, quite a big ego, and I didn't want people telling me how to raise my children. Well, what I was doing wasn't working. And I had to acknowledge the fact that what I was hearing may not have been what I wanted to hear, but it ultimately, following the treatment recommendations, was going to help my children. And in fact, it did. There were some things that weren't helpful, but by and large, the treatment recommendations helped my children. So I had to take my own ego and put it on the back burner and say, wait a second, what does my child need from me? And how can I facilitate him or her getting this in order to receive treatment and recover as best he or she is able to? The beginning phase of therapy or any treatment is after that initial evaluation and you've accepted or negotiated the treatment and you actually start the intervention. Whether you fill the medication or you show up, bring your child to therapy, or the CBRS worker comes over, or you have a respite provider lined up, what have you, or day treatment. In the beginning phase, what really needs to be addressed in treatment sometimes becomes more clear then, because the treatment provider at the assessment or evaluation phase may not have gotten the full picture. So at the beginning phase, you might see some changes occurring in the treatment plan or the direction based on what the professional is actually seeing. Realize that assessment is ongoing, and this is so important for parents to understand. It took me a long time to understand this myself as a parent, that some mental disorders may emerge or appear during teen years. So those diagnoses or diagnosis that your child was given might not be an accurate assessment of what's happening, and more may be added, or some may drop off as more information, symptoms, and signs emerge. For example, childhood onset bipolar is very difficult to diagnose. Oftentimes children receive a diagnosis of ADHD, and eventually, or some other unspecified behavioral disorder or depressive disorder, when in fact it's emergent bipolar disorder. That's just a small example of what may happen. So realize that diagnosis set in stone, yes, it's a label, but the professional, as the professional knows you and your child better and sees more signs and symptoms, this diagnosis is emergent. It will emerge. And the recommendations for treatment can also change as well based on what emerges. During the beginning phase especially, we as parents need assurance that our child's in good hands with a competent professional, and validation of some of those things that we talked about earlier. Validation of our grief, validation of the trauma we may be experiencing as parents when our child's in and out of the juvenile justice system and in and out of the psychiatric hospitals, or CPS gets called. It can be awful. Validation of the barriers to treatment that we are experiencing, especially if you're impoverished, especially poverty and all that entails. And the emotional upheaval that comes with being a parent of having a child with a mental disorder. Yes, it's real. We want the professionals to validate our feelings at the beginning phase and throughout all the course of treatment. We also want empathy, that care and concern by the professionals, acknowledging the difficulties we encounter and all the many hats that we wear as parents of children with mental disorders. And we also want education. If you recall, when my child was diagnosed with bipolar disorder and the psychiatrist said, look it up. We don't want that. We want education. We want to know what symptoms we're looking at. We want to know what treatments can help. We want to know what we can do as parents, how we can intervene to provide the best care for our child. We also want maybe education on our grieving process. A lot of us don't have experience with an actual grieving process, and it's helpful for us to know what those phases of grief might look like. And just an FYI, an aside here, if you've ever heard of Elizabeth Kubler-Ross and the 5 stages of grief, know that only 75% of people actually experience those phases. The other 25 don't experience those phases. And we also would like some concrete parenting skills. And I've got that 0 to 10 scale that I talked about earlier. It's coming up, and we've got some more concrete stuff happening in just a few minutes. But next, let's talk about the middle phase of treatment. This is the meat and potatoes here of treatment. It's also the peak resistance on our part as parents. That's when we usually end treatment. Recall that less than 10% of kids are still engaged in treatment at 3 months. Well, 3 months is not long enough for your child to really benefit from treatment. Yes, they may make small gains here and there, but 3 months is generally not long enough. We may not want to hear that the professional can't fix my kid. We may not want to hear that. So we're going to be going from service provider to service provider, shopping around until we find somebody that we think can help, when in fact the help that your child might receive is stability rather than curing, because we can't cure bipolar disorder, we can't cure schizophrenia. Also during the middle phase, and this is important for you to hear, and it's hard for me to say as a professional, but if there has been domestic violence or if you have your own mental disorders that are untreated, the professional that you see for your child may refer you to your own counselor or therapist. And it's very important that you recognize that it's not a negative statement about you. It is for the benefit of not only you, but your child. And it's very difficult for therapists sometimes to refer parents to these other care providers. We aren't trying to harm you, we're trying to help. So please put your ego aside and look at how can I best serve my child? What can I do for myself that's going to not only help me, but help my child? If you go at it with that kind of mindset, you're going to be more successful, and so will your child. Also during the middle phase, you're going to experience probably the most guilt and failure that you've had before. And I'm going to touch about that in a minute at that 0 to 10 scale. So when you're feeling those feelings, try to allow the professional to help change your guilt and feelings of failure to usable concern and concrete actions for your child. Allow your child increasing separateness from yourself during the middle part of therapy. And a big part for us as parents during the middle phase of any type of treatment or therapy is to allow or afford our children the luxury of being with another adult and forming a good relationship with that person who's there to help our child. We want to see our children as separate from ourselves, but also part of our family unit. Remember that family ego mass? We want to invite the providers in as part of this team and let them see what our family looks like, warts and all. Learn and grow with your child during that middle phase. And especially I want you to regain a sense of competence as a parent. And now we're going to turn to that 0 to 10 scale that I've been talking about. So do our parenting skills match our kids' issues? So you'll see the numbers 0 to 3, 4 to 6, 7 to 8 on your screen. This is a spectrum of children's behaviors and symptoms. 0 meaning there are none, no severe symptoms. 10 meaning the child has severe symptoms. And I've listed some of those here. Let's first look at the 0 to 3, if you can gauge where your child's symptoms are on this scale. 0 to 3 would be a mostly compliant child. Maybe some pouting, maybe a little bit of whining, and other minor childhood behaviors. If you notice the X on your screen, That's where we all start as parents. We can parent those kind of kids. Hey, no problem, right? We've got those skills because you don't need sophisticated skills to parent kids like that. We'll look at numbers 4 to 6. Those get to be more difficult, and that's usually when I start seeing parents trickle into my office. Maybe some oppositional behaviors from the child, maybe lots of back talking or lying, starting to get in trouble at school. You're getting phone calls from the principal or the teacher. Little Johnny's disturbing his neighbors and he can't sit still. Or maybe they're, cheating, doing other kids' homework for them, saying some bad words. Bad words, depending on your parenting style, could be 0 to 3. A lot of people that I treat, they consider bad words in the 4 to 6 category. Because I'm a little jaded as a therapist, I would say bad words are in the 0 to 3 category, but it's what you think those behaviors are. 4 to 6 category, could also be troubled relationships in general. Trouble with siblings, trouble between you and your child, trouble with neighbors. And that's the emergent mental disorders as well. 4 to 6, look at the X on that on your screen. We need help to get here. None of us as parents are born with or generally come to parenthood with the skills to treat children that fall into the behaviors or signs or symptoms that emerge in the 4 to 6 level. And finally, if you look on your screen, 7 to 10, these are the big ones. This is violence. These are arrestable crimes. These are the severe psychiatric symptoms. This is self-harm, suicidal ideations, threats, attempts, homicidal ideations, threats, attempts, kids who hurt animals. Those are the 7 to 10. We need major support as parents to get here. So when you're looking at your child with a major mental disorder, look back to numbers 4 to 6. You need help to get there. You need parent skills training. You need concrete, actionable items to get your parent skills up to meet the level of your child's needs. If you're tuning in today and your child falls somewhere on the 7 to 10 scale, both of my children with mental disorders did, I had to learn those skills. It took a lot of professionals to help me gain the skills that I now have in order to parent those tough to love kids, those little firecrackers, right? We don't feel competent at levels 4 to 6 if our skills are at 0 to 3, right? Our parenting skills are no match for our child's signs, symptoms, and behaviors. We want our kid to change, right? We come to a professional and say, here, fix my kid. I want the kid to change. Well, if you have a child with a mental disorder, look at this 0 to 10 chart. Look at 4 to 6. That's the average. Look at 4 to 6. You need help to get there. You need parenting skills to get there. Your skill set doesn't match your child's needs. In order to parent effectively, you got to bring your skill set up to your child's needs. If your kids are to 7 to 10, on that scale of severity, you need a lot of help from your child's team members to get your skill set up there. That could also include a probation officer. It could also include residential treatment. It could include, unfortunately, incarceration at times. It could include long hospital stays. This is what it takes to raise these tough children. So when you're looking at your child who's been diagnosed with a mental disorder and you think, I don't know what to do, it's not that you're a failure. It's that you don't have the skills quite yet to meet the need of your child. So you know what? It's time to gain some skills. And that's what the middle phase of therapy can help you do, is gain those skills. Seek out the help from your child's providers in any way, shape, or form that they provide, whether it's reading a specific article, attending a parenting class, reading a specific book, tuning into a webinar like this one. Whatever the treatment providers recommend, seek out those services. I'll give you a personal example. When my children were going through some difficult behaviors and I was trying to get my skills up to those behaviors and symptoms, school counselor recommended a great DVD that I watched, also a book that I read. Other books were recommended to me. I sought out parent skills training. I went to a family support group for 2 years. it's wonderful to seek out these resources to build your skill set and build your understanding of your child's needs. It's only going to benefit your child and ultimately your family. Well, let's move on to the pre-termination phase of treatment. This is when you practice your goodbyes, so to speak. The reality is no treatment provider is going to be in business forever, so you're going to have to get used to the fact that treatment provider that you absolutely love is likely going to move, change careers, change agencies, maybe stop taking your insurance, drop off your insurance panel. So it's helpful to teach your child how to practice healthy goodbyes. It also is the time, this pre-termination phase, of recognizing your own fear as a parent of being abandoned by that treatment provider. Don't leave me with my little firecracker. I specifically remember keeping the phone number of my child's psychiatrist in my cell phone for years beyond when this provider was no longer in business, because it helped me to feel secure that if I really had to, I had a number I could call. I never did call it, but that's that pre-termination phase. I didn't work through it very well when my children were in treatment with this provider. Finally, or almost, we move to the termination phase. And this is an exciting time if your child is going to graduate from services, meaning they've met all their treatment goals. This is a wonderful time if your child has been successful with CBRS services or day treatment or psychotherapy. It's a wonderful time. You might also see the child regress in behaviors during this time. They're testing the waters. So you want to enter into this termination phase slowly over several sessions. That's important for you to know as a parent because some professionals don't understand this termination phase very well. I know I didn't for years as a therapist, and I didn't understand it well as a parent either. So I'm hoping that by sharing this with you today, you can go into this process with a lot more understanding than I did. At this termination phase, you want yourself, your child, and the provider to mourn the loss or end of this event, of this course of treatment. And remind your child that it's okay to feel sad. Feeling sad just means that you cared about each other, that you enjoyed the time or attention that you received from this provider. You also want to acknowledge the deep bonds that your child has made with the treatment provider and also that you may have made with the treatment provider. I have a cute story. When one of my children had CBRS services, it used to be called PSR services here in Idaho. At the end of those services, my child received a little bunny rabbit, not from the provider, but from me. And my child named the bunny rabbit after the treatment provider. So I thought that was very special. That shows you how impactful this provider was on my own child. And it's no small thing to have someone care about and help your child. So acknowledge that it's no small thing. And it's no small thing to have become a better parent as a result of the interaction that you may have had with this treatment provider. I know that some of the treatment providers that my children experienced, I told you previously, I was quite resistant to. I had quite an ego. And now I consider them some of the key players in me becoming the parent and the therapist that I now am, because they took the time to help educate me and teach me and explain to me and work with me as I was trying to raise this very difficult, or actually two very difficult children. And finally, we move to the post-termination phase. Yes, there's actually a post-termination phase. Your role during this phase, after treatment ends and, little Bobby is no longer seeing the nurse practitioner, little Susie is no longer going to play therapy. Your role is to allow the child to continue to grow, to continue to change. Your role as a parent is to help your child continue to grow separate from you, but still part of your loving family. And also grow with your child and continue to build lifetime bonds with your child. Just because treatment with a specific provider ends doesn't mean that you stop learning about your child or their disorders or stop learning how to be a better parent. It's just a marker. And you also want to leave the door open for going back into treatment with your child if necessary. Obviously, if the provider has moved on or has no longer in providing services, you still want to find another provider that you and your child both can create a good relationship with. Well, What does parental involvement do ultimately? Your involvement in your child's mental treatment means it's going to improve your child's symptoms and behaviors. We know this. It will. That equals reduced caregiver burden. And that equals a better quality of life for everyone, you and your child. I'd like to give you, on closing here, a few concrete ideas for how to access some more help for you specifically. And while I'm talking about some of these, be thinking of questions you would like to ask me, and hopefully we'll have a few minutes here that I can answer some of those. Some of the greatest help I've ever had as a parent of children with mental disorders are books. And I would ask for specific recommendations from specific treatment providers. Some of the books out there are more anecdotal rather than research-based, and I think it's important for you as parents to read research-based literature that's going to help you really understand what's going on in your child's life. Obviously, Idaho Federation of Families for Children's Mental Health is a phenomenal resource. Their website has a ton of resources specific for Idaho and nationwide that you can check out. And also archived sessions of these webinars, which are awesome. Support groups can be phenomenal. There's many online support groups. There are also in-person support groups. Locally here in Boise, we have Boise Autism Moms, and we also have Idaho Parents Unlimited. Those are other resources to seek out. And locally in the Treasure Valley, we also have the Self-Rescue Manual. That's a pretty thick document, 18, 19 or so pages, that can help you learn how to overcome the negative impact of poverty. It lists a ton of resources in it. If you're tuning in from outside of the Boise or Treasure Valley area, talk to your child's school social worker, or if they have a mental health caseworker from the state from Health and Welfare, see if the mental health caseworker can access some of these resources for you. There might be little known resources that can make a huge difference to you and your child to help reduce the impact that poverty has on your family and thus on both of you and your child's well-being. Parent skills training can be wonderful. A lot of them can be found for schools. A lot of schools offer classes in parenting. Also, CBRS services, community-based rehabilitation services in the state of Idaho specifically, can help with parent skills. Also, your child's therapist, they can do parent skills training right there in session. And in fact, if your child is on Medicaid, you want parent skills training from the therapist. It really is helpful, and it proves to Medicaid that you are engaged in the treatment. Another thing is psychoeducation. Talk about educating parents as a therapist. It's actually called psychoeducation when you're teaching the parent about the child's mental disorder. So ask specific questions from the treatment provider about your child's specific conglomeration of mental disorders or your child's specific needs to make sure that it's tailored for your child. Obviously, I've talked about this a couple of times. If you are having trouble with grief or trauma or other mental disorders or distressing symptoms in yourself, addictions, domestic violence, you want to seek out your own treatment because you getting better on your path is going to help you help your child on his or her path. Also, respite care is a wonderful benefit. A personal story, I accessed respite care funds for my child when he was highly symptomatic. And it's a wonderful break for parents. If you've not heard of respite care, I'll give you a quick rundown of what it could look like. It's funds reimbursed by the state. You seek out a provider. Idaho Federation of Families actually trains providers. And that person takes care of your child, generally out of your home, for a certain number of hours, let's say on a Saturday from 10 in the morning till 6 at night, affording you and your other family members, such as your children or your significant other, time away from caregiving, time away maybe from the chaos that might be happening in your family if you have a child with severe externalizing disorders. And respite care can just be a wonderful addition to your treatment team. Well, we've come to the end now, and I hope it's the end of you not knowing how important you really are. And I would like to open up this now for questions, if there are any. Otherwise, thank you so much for tuning in, and I hope to see you sometime soon. Hi, Carol.
Hello. Teresa, I just wanted to say thank you. I mean, that was an hour packed with a lot of really valuable information. And I think for me, the very concrete examples that you gave parents is significant. And I think the two things that stood out the most to me was your discussion of parents coming into the treatment process as equals, recognizing the roles are very different, but they're being engaged and participating, and that their voice and opinions and their knowledge of their child is essential to being part of the process.
Absolutely. Without parents' involvement, the child's not going to have the same outcomes. They're not going to get as good as they could be. Yeah. Symptoms will get worse, in fact, if parents aren't involved, because if the parent's not involved, how can the child receive adequate treatment? So I totally hear that.
Yeah. And the second thing that also really resonated is I feel like with so many of the parents we work with, there's a sense of shame and blame.
Yes.
And for not having the parenting skills to deal with really complex kids. And so the way that you reframed that to be that it's unrealistic. You're not going to be able to come into this with these skills to be able to work with kids with super complex needs, so that it is okay to ask for help and to accept help and to seek help to develop those skills, so that really you're creating an environment where your child can be successful, and that as a family you all can work together. So again, it was packed with a lot. I do want to let everybody know we felt like this is such a valuable presentation that Teresa has offered, that we are going to rebroadcast. We haven't exactly decided when, but we do want to push this out as an opportunity for others to see. So I hope you will come back and join us again.
I'd love to.
And thank you for everybody who was with us this morning. Again, we look forward to next month, December, when Youth Move comes and presents from a youth perspective on their ideas about mental health treatment. And thank you much, and we will see you all again. Thank you much,
Thank you
Teresa.
so much. Great to be here. Bye-bye.